I don't love the term ethnic rhinoplasty, but we don't have a term that we've all come up with and accepted that is better at this point. So today I'm going to talk about what we have termed as ethnic rhinoplasty, but in general, getting rhinoplasty if you are not Caucasian, and what does that mean, and how you can help yourself find the best way to do that. So I'm Dr. Angela Sturm. I'm a facial plastic surgeon in Houston, Texas, and I specialize in rhinoplasty. My experience with doing rhinoplasty and talking to a lot of people, there's a lot of nuance that comes with rhinoplasty, and it's not just surgical, because a lot of these terms were come up with were devised with the idea of teaching rhinoplasty to surgeons and trying to group types of noses to teach someone how to do it and say, okay, if you have a nose and it looks like this, and this is what the cartilages are like, and this is what they're shaped like, how can I teach you how to make that better and look better? So we have grouped different kinds of noses together using lots of different terms that you talk to 5 different surgeons, and you may hear 5 different terms of how these are categorized. And some of the terms are things that you're never going to use in real life because it's an aquiline nose or something like that. Nobody really knows, outside of people doing this, what that really means. But what's more important, I think, from a patient perspective is what applies to you, and when you look at their work, what is reflected in their work, and is that reflective of what you want? Are they doing noses that look like yours? Because there can be 2 noses of different ethnicities that have similar qualities that I'm going to address in similar ways that has nothing to do with their actual ethnicity. It has to do with the structure of the nose. Or you can have 2 people of the same ethnicity that their noses look completely different where they're starting, where cartilages are completely different, and I'm going to do 2 completely different surgical plans for them. And so it's not as useful for me to categorize them into specific ethnicities, more so of the type of nose that you have, and be able to discuss with you where you want to take this and what you want that to look like. I think it's more important that we talk about being appreciative of their culture, being appreciative of their ethnicity, retaining that. Those are conversations I have with my patients. When you look at your nose, what do you like about it? What do you not like about it? What do you want to keep? What do you want to change? And I think it's important to me to be very respectful of where they're coming from, because there are people with a bump on their dorsum that really want to keep that because that is part of who they are. That's part of looking natural for them. That's part of, I've had people say, that's my dad's nose, that's my son's nose. I don't want it to be a different nose. I just want this part of it refined. And so that is a whole different surgical plan for me than if you just say, I'm doing a rhinoplasty and I do the same thing that I do every time. And so that's what's fun for me, is I get to talk to people about who they really are in these contexts and what does that mean to you, and how can I help you achieve your goals. Every surgery that I do is a little bit different and framed in that respect for their ethnicity and their gender and all of the different things that make up who that person is. When you Google ethnic rhinoplasty, that's still the best thing to Google, because that is going to take you where you need to go. That is going to take you to the surgeons that do what it is you're looking for them to do. But I do think, and this is actually a conversation that's going on in our societies and within our groups of surgeons, of how can we name that more appropriately, and how can we make that more respectful of our patients and what they're wanting to achieve. There may be similarities in what people are wanting, but not always. Some people want to look a lot different, and some people want it to be so subtle that nobody knows but me and them, and I think both are wonderful and both are great. But it is important, if you are that person and you're looking for this, that you find that person that's doing what you want them to do. Because if you're going for a Barbie nose, you need to go to the Barbie nose surgeon. I'm not the Barbie nose surgeon, but there are some, and they're super cute, or if you're going for that super subtle, you and I know, and we look at the before and afters and high five, but the rest of the world doesn't know, you need that person. You need to see in their before and afters that they have people that look like you, and that they're doing a lot of these surgeries on people that look like you, whatever that is. Can they give you examples of noses that are similar to where you started and are where you want to go, and can have a really open conversation with you? Or is it, oh, you want to nose job, we can give you a nose job. It's not that simple, and that's not the conversation that you deserve. I've been thinking about it, and we've all as a society been talking about what do we call that, and I like culturally respectful or something like that. If you have ideas, please let me know, because I would love the ideas of ways that we can best represent our patients and what we're doing for them and how we can do things for you and how we can help you along this journey. Let me know what your thoughts are, and if you would like to discuss further or more individual, the best way is with a consultation at www.drangela.sturm.com or any of the socials at Dr. Angela Sturm.